Good evening, everybody. Thank you all for turning out to what, in effect, is our second general meeting of the year, which we felt we had to call, not necessarily at short notice, but can I thank you all for turning out. I know there are some people here who shouldn't be here due to ill health. We particularly welcome Jenny from Chorley, who's travelled over to support us, so thank you, Jenny. Normally, as you know, we have annual general meetings, but we called this meeting tonight because of the latest developments that there have been around the announcement by the Trust that they were going to keep the accident and emergency open, that they weren't going to demolish Huddersfield Royal Infirmary, and until people read the documents, there was premature celebrations around the town and on some Facebook pages. But when we looked at the detail, we realised that, as we've said in our postcard, some people are trying to pull the wool over our eyes, and that is repeated in tonight's Examiner. So we felt it was important to review where we were up to and to explain what we think needs to happen in the next stage of the campaign. And a lot of people have been asking us, where does this leave the legal challenge? Well, that's a question we've also been asking Erwin Mitchell, and in turn they've been asking our barristers and Silk about where that leaves our challenge. So, in terms of the format for tonight, we have a star-studded top table here. Most of you, although I know there are some new faces here, so I will introduce Yogi Amin, who's been with us since the beginning, and Head of Public Law at Erwin Mitchell. He does come here tonight at great expense, but we felt it was important, unless it's donated. So we will follow the usual format. I think this is the fourth time that Yogi has addressed us, and he will present you with an opening address as to where the legal challenge is. And then I'm going to open it straight up to questions that you can put to Yogi. We then have Jackie Grunsell, who will be known to a lot of you as our member of our steering committee and campaigning GP in the area, who had the privilege of meeting with the Trust as a member of the local medical committee 2 or 3 weeks ago, where they outlined the real plans for Huddersfield Royal Infirmary and the accident and emergency. And then, at great expense to himself, but not to the campaign, and we thank Tony for that. Tony O'Sullivan, who is the co-chair of Keep Our NHS Public and a founder member and leading light of Save Lewisham Hospital campaign. Those of you who can go back far enough will remember that Vicky came to address our general meeting 2 years ago, and she sent Tony this time. So Tony will there are striking parallels between the successful campaign in Lewisham and our own campaign, which Tony will draw out at a later stage to round off the meeting. There is a sign-in sheet, but accompanying the sign-in sheet, there is a little box that you can tick if you're not already involved in either a local group or any of our action committees. We are using tonight's meeting to appeal for particularly new people to get involved in the work of the campaign. So, and can we thank John Popham, who is streaming this live on Facebook. Does everybody know what that means? It means you can go home and watch it on your phone. And also Audley Buckle of Chicken and Chips fame, who has provided the PA at no expense again to the campaign. So, sorry, I should have introduced myself. I think most of you know I'm Mike Foster, the chair of the local campaign. So, Yogi is going to speak for 10 to 15 minutes. If you'd like to make detailed notes, prepare your questions, and we'll set aside half an hour or as long as it takes for you to ask him where we stand. So, over to Yogi Amin. Thanks very much. Can everybody hear? Okay.
Yeah.
Hi.
So I'm not going to, unfortunately, set out a roadmap today of what our legal strategy is going forward, because you'll appreciate there's some detail we don't, a bit like some politicians are doing at the moment, they don't want to reveal their full hand on how you negotiate with the lawyers for the CCG at the moment. But because we are in a situation where we've lodged a judicial review in the High Court. There was quite some backwards and forwards about the evidence in that judicial review. Questions from us, evidence being lodged by the clinical commissioning group and the trust lawyers. There was the backwards and forwards, and then we went into the court, in the High Court, where the judge considered whether the judicial review had arguable grounds. And we had about 4 or 5 grounds which we were contesting whether their consultation and the proposals by the CCG were lawful. And we were successful in the High Court, where the judge did say that the grounds that we brought forward to bring the challenge were arguable. So we were granted permission in the judicial review to go ahead to a full final hearing. So there was a victory at the initial stage, and that was no mean feat, because at that stage it was a fully contested argument by the clinical commissioning groups and trust lawyers. They wanted to throw out the case and say there were no grounds for a challenge. So there was a full day hearing, many of you were there, there was a full day hearing in the High Court in Leeds, and then the judge gave a detailed judgment and said there was arguable grounds to bring the challenge. And so from there was then the hiatus where the Secretary of State had a referral from the Joint Health and Scrutiny Committee, and we wanted to see what the response was. And the response came back from the IRP, the Independent Reconfiguration Panel, which the Secretary of State had asked to give an independent view about the proposals. And the Independent Reconfiguration Panel did come back with a number of concerns about the CCG's proposals. So that then threw our case into a situation where we wanted to see how the CCG responded to the Secretary of State's concerns, to the CCG's the Independent Reconfiguration Panel's responses, and to the judicial review. Because in the legal case there was provision for the clinical commissioning group to file more evidence. So where we are is that on the 1st of October, that's in a week, we're expecting the clinical commissioning group to file all their evidence as to whether they think the full business case, which is what they set out originally, remains. And it's pretty clear now that the full business case as it was a year ago or so is fundamentally changed from my point of view. And I think it's going to be very hard for the CCG's lawyers to argue that it hasn't changed fundamentally. They have put forward new proposals, and those proposals you're going to hear about from Jackie and others today, they've put forward in a document to the Council Health Scrutiny Committee. So with their lawyers, they're going to be coming forward, hopefully, by the 1st of October, to tell us whether these new proposals still are part of what they originally planned, whether they're a bit of what they originally planned and a bit of a change, or whether they are a wholesale fundamental change, or somewhere in between. And what they tell us impacts on the legal case, because the legal case has been stayed, so we put a a halt on it, a breather, until the 1st of October, to allow them these 2 or 3 months to reconsider their position. We didn't want to go ahead with a High Court hearing when they were reconsidering their plans. So I think we're in a good place in that we've still got the legal case in place. The judicial review is still ongoing. It's still live and kicking. There's no, we haven't resiled from our original position. All the grounds that we were granted permission by the High Court to proceed on are still there. All the evidence that we filed in the case is still there. What remains in question, however, is when we get this evidence on next week, on the 1st of October, whether the CCG are going to be saying that the case should end, the case should change, or we're not sure what they are going to say. They haven't revealed their hand yet. We have been asking a number of questions of the CCG in the meantime, because it hasn't stayed still. There's been the government proposals for extra funding. There's been the government suggesting that there's changes to the immigration arrangements for workers in the NHS. There has been questions from us about the finances and how they're setting out the finances at the CCG, and there were questions about interim changes and whether they were making some of the changes to the services between HRI and Halifax changes from interim to permanent. And what they have said is any interim changes they were making have not been made permanent. And legally, what that means to us is they've confirmed that if they are going to make them permanent, we will demand that they have to go through a formal legal process to make them permanent. So we've got that in writing from them, that no interim changes have been made permanent. We're trying to pin them down on the evidence about how they've set out their activity models, which is what they're trying to base their evidence on for making the changes. So a number of the arguments that we're making, a number of the points we're trying to get out of them in terms of the evidence, all is still live in the legal case. So it's far from over. I know it's been a really long road, because a year and a half ago or longer we were saying, get your voices out there, make it clear what your objections are and your points you want to make in the consultation. If they'd had the consultation, they then made the decision. A formal decision by the board of the CCG was the one that we challenged in the High Court. They haven't withdrawn that decision yet. They've just reported on proposals for a new change. I'm pretty clear that new proposals, keeping the A&E and new changes that they're making, I don't think can continue to be said to be what they originally proposed. Which would mean, legally, we would expect them to go through formal steps for new consultation and public involvement again. I know some of you were thinking, oh, it's another round of consultation or discussion. But that is the law. The law is, if they do want to make changes, they do have to involve the public formally. Those are the legal requirements. So, a few months ago they were proceeding with their plans. What it looks like now is a new set of plans, and legally we were very carefully watching what these proposals are and trying to get clarity on whether, if they are new proposals, what the new process is, what the new involvement is, what the level of public involvement is and formal consultation. There's evidence that's been gathered in the legal case which will not be lost, and there continues to be evidence that's being put together in the legal case, partly around evidence on what the community proposals are that the CCG is suggesting, because they're suggesting that there's all sorts of capacity for care in the community, which would allow reductions in hospital beds, etc. So we're not climbing down on ensuring that that evidence is there, available. So if the legal case did end and a new process started, that evidence will still be available for use. I am cheap tonight because I'm funded on legal aid.
Oh, good.
See my client here this evening. So I'm here to answer questions. I think I should also say, Mike, Christina and Steve came, we met last week and we talked in detail about the timescales and the judicial review. The second timescale is, so they file evidence by the 1st of October, we then are directed to respond by the 19th of October. That's when we've got to decide in the legal case whether we want to continue with the case or propose a settlement. So it's a small window, 2.5 weeks, where we'll get to make that decision. And obviously be talking with people here and Christina and Michaela about that. If we are looking at the case ending, it wouldn't be, in my view, an open and shut case ends. It would be quite a detailed roadmap, in my view, of what the legal requirements would be if there were to be further wholesale changes in a new business case. Because what was talked about before with 300 million plus seismic, serious proposals which required legal steps to be taken, what's talked about now continues to be serious funds being proposed for wholesale changes to hospital services, well over 100 million. So there continues, in my view, to be quite clear legal steps that CCG would have to take, involving public involvement, listening to the local people. And so that roadmap, those steps, if the case was to end, would need to be set out quite clearly, in my view, on paper. And so that's what we're here for as lawyers, and make sure we will do. So I'm open to questions.
Are you done? Thanks, Yogi. Just to reassure you all that Yogi has seen there's not much detail to them, but he has seen the proposals of the trust that we've publicised through the Facebook page, and is aware of what their intentions are. So, questions? Do we need a roving mic, Alan Lansdowne? How do I get this out orderly? I'll let you try.
Just turn it round.
Turn it round. Right. Bridget first, and then who else? Yeah.
Right, whatever happens, it looks like we're going to have, again, a long period of waiting and seeing, putting evidence together, or whatever is going to happen. I think my concern, and I know it's the concern of a lot of people, is that while all this is happening, they are doing it by stealth.
Yeah.
We know they are. We can see it, we're experiencing it. So what I'm saying is, have legal avenues been explored where we could, one, force them to have to announce very clearly what it is they're doing each time they do it? And is there a legal way of challenging that? I know that's a double-headed question.
That's a good question. Can we take one other question, Alan?
Yep.
Yes?
Mine was very similar really. It was how long is temporary
Yeah. Or interim?
interim?
Yeah. Okay. Is there anyone else? Because Yogi can take...
Yeah, they were. One of the points were equality, and what I found is there's lots and lots of people coming saying they can't afford to get back. Even on our wall, our social media, somebody suggested that the daughter was in Halifax with a child and no money to get back, and the impact that, well, she had to pay for it when the taxi arrived, but you know, that isn't an option for some people when they're turfed out of A&E at 1, 2, 3, 4, any time of day. They just simply can't afford to get back. So you know, there is an equalities issue, even regardless if the trust do walk away and have changed the plans sufficiently enough to fool everybody. That is still an issue, and it will put people off seeking medical attention.
Yes, last one, Ian. Is there any way... All right.
Doesn't need it, does he?
Bring us back here then, Alan. Is there any way we can force them to spell out exactly what they're doing? Because they come out with these statements and they're pure fantasy and everybody believes them. And then they come up with various other stuff at the end of it. It's all right saying they're building a multi-storey car park, where, and, you know. And it's saying with that, oh, we're going to build another 4 wards, do this, do all that. But there's got to be some substance at the back of it. Not just fantasy island.
Yeah.
If I just deal with those in parts then. So, interim, we talked about last week coming down with getting a detailed list down now, because what we were talking about a year ago or 6 months ago shifts a lot. And so I think I'll sit down with Jackie and others and just get a clear list now of what we think does exist at the moment and what is being asked to be transported across. But also, yes, writing to them now. So we're going to be asking them to provide a clear list now of what is available in Huddersfield, what is being asked to be provided in Halifax, and being clear about it, because I know there are some services on certain days that are different, some services where sometimes it's provided here, sometimes it's been moved over there, you get anecdotal information. Anything you can provide by way of an email also to the group would be really helpful, even if it's anecdotal, about the specific health services which you think are not being provided here and are being moved over, or have been moved over, interim or otherwise, to Halifax. It will all be helpful for us, because we do want to get down on a clear list now what is available now here locally, because then we can, if we are going to pin it down in October to ask that nothing is moved or nothing is shifted, or that it is, if it is shifted, it's only shifted with prior notification to us, then we're in a position to bring a legal challenge to it. I've said in the past that we could try and challenge by any stealth changes if we get evidence, clear evidence of a clear change in service. And there have been examples of where they've talked about winter crisis, etc., and said it's an interim move, and we've seen it in other parts of the country. But in another part of the country, we've got a letter from the lawyers for the trust to confirm that they will notify us with 48 hours notice in advance of any interim changes to the specific services. So I think we'd like to be in the same position here where we pin them down to that agreement that they notify. It's going to be difficult for them, I grant, because organisationally it might be difficult for them, but if it's legally required, I think that would help us going forwards. So that's the interim and stealth changes. In relation to any evidence of people being asked to pay for travel, again, we need the evidence of people being asked, and if it is the case that people have been asked to pay to travel back, we can raise that within the case to get confirmation that they shouldn't at all. Because if there's an interim change to a service from here to another town, it should be covered within the cost of the NHS service. Legally, they'd be required to fund it. What was the third point?
It was Ian's point about when are they going to publish their plans.
So they have, well, the 1st of October is when they're going to tell us, with legal lawyers' letters, whether their plans are different from the original plans. But we've already got a list from them, a bullet-pointed list where they talk about single expert team models of care at Halifax, and but there's sort of quite generic wording about strength and community, and Jackie will talk about it in more detail. So at the moment I've got lots of questions because it's relatively vague, and I think that's what you're saying. So we'd expect it by the 1st of October, but don't be surprised if they turn around and say we want to make this clearer and define it further after some more consultation. That might be what they say.
Yeah, but what I'm trying to say is, it's all right them coming out with these grand ideas, sending it down to the Secretary for whatever he's called now,
Yeah.
and him saying, "Why, good, this is a good idea, yeah, you passed, get on with it." And then like all big organisations, it comes up with, well, we can't really do that now, and we can't do this now. We need to get the full thing down before they send all this pie in the sky stuff down there for them to get it passed.
It's slightly unclear what the Secretary of State's role is going forward.
Yeah. Or backwards for that one.
But the latest we've been told is that it's for local decision making. And so I think the idea that the Secretary of State is going to get involved at this stage is probably wrong.
This is the man who's been running our prisons for the last couple of years.
Yes, Wendy.
Could the challenge, like with stealth, it's obvious Ward 22 closed for winter pressures and it's still not open. Staff have left.
Yeah.
So that ward has gone.
Yeah.
That's the respiratory ward, isn't it?
Yeah. I thought it was 21.
It's now turned into, as far as I'm aware, not like an elderly ward.
Right.
So whenever we challenge an interim move, which they want to see as permanent, we're going to be faced with an argument from their side as to whether it's turned into a good thing, clinically.
Well, it's happened from the uncle anyway, because he died, you know. So.
And so we can challenge each and every one of them, but you are going to expect a response from them with clinical evidence about why it might be a good thing. And of course then you're going to have to try and counter that. But each and every one, I'd like to know each and every one that we want to get down on paper to ask them to repatriate or confirm is not a final change.
How does this relate to changes, other changes? I gather from when I was in hospital recently that one of the other services was moving to Bradford, and a lot of the staff were leaving Huddersfield to move to Bradford with it. This is sort of not exactly what we're campaigning against, but obviously it's sort of tied up in it, isn't it? In sort of weakening the provision in Huddersfield.
I think these proposals, I'm right, Jackie, saying they don't really focus on services going to other parts of the footprint of the region. And it would make sense for them to set out what is going to other parts of Yorkshire as well within these proposals.
Yes, Bridget?
I just think one of the problems that I've seen is that I honestly don't think they clearly know what they're doing. And I'm not using that as, oh, they're all rubbish. I don't mean it like that. There seems to be so many fingers in the pie of decision making that either they're not clear about it or they're purposely obfuscating, purposely, muddying the water. So we don't know what they're doing. It just doesn't seem very clear at all. Maybe it's because they're not very bright. I don't think any of us know what they're actually doing. And there's certainly a regional element.
Yeah. Any other questions? I appreciate some of this is very technical and detailed, but this is the information that we need.
Can you just tell me, is it dead in the water, the thing the council was talking about, having a Hercules hospital?
£300 million new hospital.
Was it just...
No, but I don't...
Yeah, a month or two back, they were saying about having a Hercules hospital. I mean, has that all just got...
No, I'm not sure if you can you comment on that?
Just legally, it is a new proposal. It is a new option. It might be at that very, very early stage as they're setting it out. But right at the start of this case, I was asking people, what's the alternative options? So if you're asking that question now, this is an alternative proposal which legally can't be ignored by the CCG. So whatever people think about it, we've got to treat it, the public have got to treat it as an option that could be worked up as an alternative. Two others, I think, yes?
Just going to expand on that one.
Sorry?
I was just going to expand just one comment on this hospital.
Yeah, Alan, where are you?
Yep.
Okay, I thought
Doesn't need it.
yeah, it's just about the...
Just introduce yourself, Jenny, because I welcomed you, but not everyone knows who you are.
Yeah, I'm Jenny Hurley. I'm from Chorley and South Ribble. We've got very similar model going into consultation around about May next year. So A&E's closing, planned care being moved out of hospitals, and we've got one of these famous hospitals replacing some of ours as well. It's off, it's okay. So it's all very, very similar. Now within this consultation, we've had this, all the way through these changes, we've had this other hospital on the books ourselves. Very, very, very similar to what you get in here, the same model. This consultation, that hospital isn't involved in it, partly because some of the services going into this new hospital are going to be footprint wide, so they're therefore saying that it isn't a central Lancashire issue, therefore isn't in this consultation. And also because to actually build the thing is going to take between at least 5 to 10 years, it's not in this consultation because these could be interim consultation. So when 5 to 10 years down the line, if they get bid money for this new hospital, then you'd be going into a new consultation. So first of all, it's A&Es and moved services, which is what you're getting here in this area. And then if it's going to go out footprint wide and other services being moved in, ours is for 1.3 million people. Some of those services could be covering if that's the case. But because it's not central Lancashire here and now, we're told it's not in this consultation.
I'm just looking at the document that was presented at Calderdale and Kirklees Joint Health Scrutiny Committee. This document's actually signed by both the Calderdale and Greater Huddersfield CCGs. And it kicks off basically by saying that in 2018-19, the Trust must deliver savings of 20.8 million, which is 4.9%, plus in Greater Huddersfield, another 7.7 million, which is 2.3%. So this is what's driving it. And then they all say, all parties accept that to do nothing is not an option. Now, actually, it seems to me that it is an option, because they say it's really important in this document that they deliver health and other benefits. But actually, these proposals are leading to a great reduction in the health that's being provided. And if we look further in this document, it's really, really shocking what they're saying. And it really tells us what's coming our way. The most breathtaking thing about this is that they've managed to go away, look at their proposals, and save themselves another £100 million. In other words, they are just really determined to cut us to death. This is a vicious attack on us. It really is. I mean, I could go on and on, but I'll just start ranting.
Was that a question?
At the same meeting, it was said that, so there at the end, if I picked it up right, the £197 million that's been offered by the government, the Kirklees Council bid, it will affect that somehow, or they won't get it if there's a bid. Could you explain that a little bit?
Steve Slater will explain that.
Well, as I understand, Nicola, what they're saying is, if the Kirklees Council proposal delays matters, or anything that we put forward delays matters, perhaps, and there's further consultation, then it's a threat there that money may not, they may miss the boat. I would say that, we have to ignore that threat, but that's what they're saying.
Yeah. Are there any other... Yogi, can you just clarify for the benefit of the audience, because I know it's what we discussed in Sheffield last week. Where do we stand if they decide to withdraw the full business case on the 1st of October?
So if they decide to say that the last full business case they produced no longer exists, and they've got a new one, then, as I was mentioning earlier, I'd want a clear roadmap of the legal responsibilities they've got for this new one, so that you're not left in the lurch, essentially, starting afresh with no clear roadmap of the legal steps that they need to take.
What's going on, Audley?
Right, the legal steps that they need to take if they are to produce a new business case for these proposals, because I've said it's over 100 million again, it's all, and if it is a new case, they will need to take these steps. So then I would want that wrapped up within the legal orders within the court proceedings.
But could I just check, we wouldn't be able to go ahead with the existing judicial review if they say, no, this is a completely different business case. Is that right? Have I got that right?
It's more likely that is the position, because
I shouldn't...
we were challenging one decision, and if they come forward and say we're making a new decision, then it would be very complicated to just carry on with one case. There may be a new decision which then may have its own flaws, which may then lead to another case. But that is not of your making, that is of their making, because they are changing their position and making new decisions. So it's of no one's making it other than the CCG themselves.
If I could just clarify that if I was them, and I'm not, I would withdraw the full business case with smoke and mirrors in place, but saying it no longer exists. There is a new business case. And I think I'm right in saying, Yogi, that if that's the case, our judicial review wouldn't be heard because we haven't got anything to review because they've withdrawn the case. Now, we could claim on the basis of that we forced them back in terms of withdrawing their case. And we should, without this legal challenge and without this campaign, they would have demolished HRI and we'd have lost our A&E. So we pushed them a lot further than they intend to go. However, joint health scrutiny then are obliged to demand the new business case. In fact, they are obliged to produce a new business case, which will be subject to scrutiny. To end the legal case, correct me if I'm wrong, there still has to be a hearing, because a judge would have to consent to the end of the judicial review. And what Yogi is saying is that a judge would have to issue what's called a consent order. And we are trying to get written into that order certain legal guarantees about what would have to be in the next business case. I think is that right? Yes. Yeah. And see, I said that without being paid, so that's so there is going. I know, it's fantastic. So there will either be a hearing in Leeds Court, or the judge will look at the paperwork and make a decision about what's contained in the consent order. And whilst all that's going on, it's still a legally aided case. The sting in the tail, which we have to make everyone aware of, is if the judicial review is then finished as a result of the issuing of a consent order, so is our legal aid. And therefore the campaign group, in order to continue to have the services of Irwin Mitchell, would be once again paying for the advice and guidance, which is where we all will come in terms of continuing with our fundraising. They will be obliged to produce another business case. We think that they will be obliged to consult on that business case. I think that what they have done so far is more flawed than their original business case, because they seem to have produced a half-baked plan without proper costing, and the only publicity that's been given to it is the publicity that we have given as a result of the briefing that they gave to the local medical committee 3 weeks ago, which Jackie will outline in a minute. But the £197 million that they're asking for, that the Secretary of State has still not granted, only 20 million will be spent on Huddersfield Royal Infirmary and the rest on Calderdale. So it gives you an idea of where they want that money to be spent, which means there is inherent, almost immediately as far as I'm concerned, a huge challenge. How have they arrived at that? What's informing their decision making? And how are they going to meet local need? And how will they develop alternative community proposals? We've read the documentation that went to joint health scrutiny. So we know what they want to leave behind in Huddersfield and what they want to try and create in Calderdale. And we are drawing what we consider to be red lines of what would be acceptable to us in order to maintain services at Huddersfield Royal Infirmary. The other question I've got, which nobody can answer because I wrote to the Secretary of State saying, where does this leave the independent reconfiguration panel? I'm not quite sure where it leaves it. Because it was referred to the IRP. They said this is a flawed plan. Jeremy Hunt said this is a flawed plan for all these reasons. And then when we said, so what is the decision of the Secretary of State? They replied by saying it's for local determination. So we think the local determination is the report that NHS England, NHS Improvement, the CCG and the Trust, and also now the STP have signed off on. And that's the report that's in the public domain. However, 2 other reports were sent to the Secretary of State, one from Kirklees, so it's not dead in the water, and they are obliged to consider that. And also, unfortunately, a report from Calderdale Council which said this is fantastic, we think that we should proceed. So, the reason why we are very interested in the Kirklees proposal is not necessarily because we think it can grow legs, but it is a plan B. And we were always saying, where's your plan B, CCG? And now the council has come up with one. And if that plan is rejected by the Secretary of State, in preference for the plan of NHSE and NHSI, there's all kinds of acronyms flying around now, then as far as we're concerned, Kirklees Council have got a legitimate legal challenge. And we've advised them of that, and for the first time we would expect Kirklees Council to come on board with us in supporting a second legal challenge. We would then be looking towards Irwin Mitchell to draw up a second legal challenge and to see if we can get legal aid for that. So in effect what we're saying is we're 2 3/4 years in the campaign and this isn't going away. This is going to continue for quite some time, which is why we've got to refocus our energies and redouble our efforts and make sure that we keep them on the back foot. We are very well aware of the changes that are taking place by stealth, which are a disgrace and need to be called out as such, because we are slowly losing NHS services to Halifax. We can try legal measures as best we can, but also we've got to draw it to the attention of politicians and the general public so that pressure can be applied. I think anyway that we've reached the end of your submission, unless you want to conclude, Yogi, because I want to hand over to Jackie so she can explain what the details, such as they are, of their proposals are. You do want to
the only concluding point I'd make is what we discussed with the barristers and the QC involved in our case. They made it very clear, and we think this is a significant victory as a result of the legal challenge in terms of the CCG moving on to a new proposal. So I know we've still got work to do in October, but if I was standing here at the end of October, I'd be telling you it is a victory. So, yeah, well done.
By the look on everybody's faces, not everyone feels it is. But I come back to what I said earlier, that they would be going ahead and demolishing the hospital now if it wasn't for this campaign, and we'd be left with a 64-bed facility at Acre Mills and a second PFI. They've been forced to withdraw all of that. So we're halfway along the road. We know what they're doing behind the scenes, but now we've got to push them the extra mile. So we want them to spend all of the £197 million in HRI. Anyway, I'm going to hand over to Jackie Grunsell now, who will report back on what we considered, what they said to the local medical committee 3 weeks ago.
Right, thanks, Mike. I think it's an interim victory, and there's no doubt about it, one of the strategies of the Trust and the CCG is to wear us down. And they want us tired and not able to maintain a campaign. And so, a protracted period of time that this goes on for in many ways suits them. Although, I would say there's another aspect to that, and that is, I think, if they want to get this money that they're after to make the investment that they want, the new proposals involve, then they do need to move on that fairly quickly. And so, there are pros and cons for them in terms of dragging things out. But I think they were probably hoping, certainly the implication that somebody from the CCG made a few months ago, a while before this new proposal appeared, was that NHS England was suggesting to them that they should call what's left in Huddersfield an A&E, but it not be a full A&E, and that would make everyone happy, and the whole campaign would just go away because they think we're that stupid. I mean, you know, it does beg a belief really, and that in effect is what they're doing. What we've got is an amended proposal that really takes us to the same end result, just over a longer period of time. And what they call a new approach, which is a phased route to a fully reconfigured service. So that's, you know, that's their jargon for it. Just to sort of go into a little bit of detail about what I was led to understand the new proposals involve. First of all, what they have done is cut the amount of funding that will be required for this new proposal. That's because they no longer intend to build a new hospital or a new planned care unit at Acre Mills. They no longer intend to knock down HRI just yet. They intend to maintain that building for a bit longer and to keep some of the inpatient beds that are there remaining at HRI. Therefore they won't need the same funding that they would previously have needed. And because of that reduced requirement for funding, and also some recent changes that have been made in the way that funding is given to these kind of proposals, they now can apply to the Department of Health instead of potentially previously having to go for another PFI. They can now apply to the Department of Health for that funding, and they are expecting to hear, they've already made the bid, and they are expecting to hear in autumn, which is now really, whether that case, that bid has been successful. And apparently they were prioritised, they're quite high at the top of the list, if you like. So they're expecting to get that money, I think. And that's 197 million instead of the previous 300 million. So they told us at that meeting with the LMC that they would then have to prepare a more detailed business case, a new business case. So it suggested to me that in effect the old business case would be abandoned, and they would prepare a new one once they know whether they have got that funding or not, because it all hinges on that. What they've said will happen, they acknowledged that there is no capacity in community services to be able to cut the number of inpatient beds in the hospital. Well, they wouldn't have realised that without this campaign, apparently. You know, so they recognise that is a problem, that community services are inadequate to achieve a better discharge rate from hospital and reduce the demand for inpatient care. So what they have said they are then therefore doing is separating the need for a reduction in beds, which they think they will be able to achieve over a more prolonged period of time still, by improving community services. They're not exactly clear how they're going to do that. They will still be able to achieve that over a longer period of time, but at the moment they're keeping the same number of inpatient beds, and they're separating that from the business case because they acknowledge they can't win on that point, basically. So what will remain at HRI, they said is around 100 beds, although they haven't made up their mind about that. I actually think they have made up their mind about a lot of this, but they didn't want to tell us. In the same way as right at the beginning of this plan, a meeting with GPs, the CCG told us they were going to close one of the A&Es, but they hadn't made up their mind which. You know, they clearly knew far more about the proposals than they were letting on. So, but those beds will be of a completely different nature to the ones that are there at the moment. So they will be mainly elderly care and complex care. They will not be patients that need acute medical care. They won't be patients that need coronary care or intensive care, because there won't be a coronary care or an intensive care unit at HRI. They will be patients who are stable. They will be fairly well but not quite ready for discharge. But they said they're still working on the exact nature of those beds. But in effect, what they're talking about is a rehab ward. That's what they're talking about that will remain at HRI. Everything else, inpatient-wise, will be going to, inpatient medical-wise, will be going to Calderdale. So you know, it's really not a fundamental change in terms of that, in terms of where acute medical care will take place. That will still take place at Calderdale. All blue lights will still go to Calderdale A&E. Although there will be what they call an A&E at Huddersfield, it won't deal with any blue light emergencies. It will be a place that patients can be stabilised, and then if they need inpatient admission, they get sent to Calderdale. Or if they need more intensive or emergency care, they get sent to Calderdale or elsewhere, depending on what the problem is. So this still really raises the problem, if not more than before, of issues to do with transport, the ambulance service, and the strain that this will place upon those services. And they acknowledged at that meeting with the GPs that there was a challenge for them in terms of the capacity in Yorkshire Ambulance Service, but their only answer to that was that Yaz would have to commission that. Yeah. So that was that, end of story, no other comment on that issue. So, in other words, there's big concerns over whether the ambulance service has the capacity to deal with the increased travel that will be required to achieve this. The proposals for the urgent care centres at both sites are exactly the same as before. There's no change in that. They say they will be medically run, and there will be a consultant available to be discussed with. The same is true of A&E, but that does not mean a consultant will be present. They will be able to be on the end of a phone or a Skype chat, if they're not dealing with an emergency in their own A&E, then you know, there will be somebody there on the end of a phone, but not present in those units. They said they haven't worked out the exact hours that consultants will be present. All GP admissions would go to Calderdale. So really, in terms of the A&E services, then there's very little change. Apart from the fact that patients will be possibly able to be stabilised in Huddersfield to a greater extent than they previously would have been under the past proposals. Within the 197 million bid, then, as Mike said earlier, 20 million of that they thought would be for refurbishment and improvements at HRI. Their take on it is that HRI is still a building that has only got about a 10-year life, still full of asbestos, still in a terrible state of disrepair, although our surveyor begs to differ on all of that, and Steve is meeting with the Trust and the surveyor later this week to discuss that in a bit more detail. But they didn't commit themselves on how much longer they thought the life of the building would be extended by investing this £20 million. The 177 million remaining will be invested in Calderdale, with the expansion of the A&E, the expansion of critical care, the building of 4 new wards, theatre improvements, a dedicated paediatric emergency department and a multi-storey car park. So that's where the money's going, if they get it. There is no money for increasing the capacity of social care services to enable faster discharges, better discharges, that kind of thing. There is no increased funding for GP services and other primary care services. They say that doesn't matter because they haven't reduced the number of inpatient beds. But how are they going to reduce the demand on A&E, which they said was critical to the proposals being acceptable in terms of safety? Because the demands on A&E will not change if they don't improve those services. So, I mean, obviously, there's just loads more, really. We, as GPs, expressed ongoing concerns over a complete lack of progress in developing the capacity of community services to deal with all of this. The fact there is no extra funding for anything in primary care, the difficulties that social care services are facing, and the ongoing crisis really that we're facing in the community, and the services and the way they're provided there. There was no mention in the new proposals about funding for any of these services. So they also said that the new proposals are actually going to cost them more long term, although it's less money in the short term because they are duplicating certain services that they weren't doing before. And they anticipated a break-even position 4 years later than the original proposals as a result of this. So there's still financial problems, but we haven't seen any detailed costings. They haven't revealed any of that to us. So what is clear is that whatever happens, really, we've got to continue to campaign on this. What we're getting is sold a bum deal, basically, something very similar to what we had before, although they want to dress it up as something better, a new improved model. But if they're saying that it's so different to the last proposals, then as Yogi and others have pointed out, then they have to go back to reconsult with the public on this, because it's a whole new plan. So they can't have their cake and eat it, basically, and they certainly won't be given the opportunity to do that as long as this campaign continues to operate in the way we have done. Thanks.
And again, if we didn't have a campaigning GP sat on the local medical committee, we wouldn't know about any of this. Talking of campaigning GPs, I'm going to go straight on to Tony O'Sullivan, who is the co-chair of Keep Our NHS Public and also a former consultant paediatrician, is that right?
Yes, talking of GPs.
Thank you. So Tony will speak for 10 to 15 minutes and then we'll carry on the discussion as to what the campaign is proposing to do next. Over to you, Tony.
Thank you very much. And I always think paediatricians and GPs have got a lot in common. In all these business cases, you see bits on mental health or bits on cancer care or bits on diabetes, and then you see a bit on children as though they're a disease entity. But in fact, GPs have to deal with everything that is thrown at them and do that incredibly, and that's their skill. And to a certain extent, paediatricians have to deal with everything that comes their way as children. My own specialty was children's disability, things like autism and cerebral palsy. And so my whole life was steeped in working together with social services and education and families and GPs. And I know what integration means, even if Jeremy Hunt doesn't, Simon Stevens. I think what Mike says you really would like is some kind of comparison between Lewisham and what you're going through. And I think it's really important. My starting point, though, is really that, as a doctor, we're supposed to make decisions based on evidence. And that's supposed to be our calling card, that doctors know what they're talking about, or the health service knows what it's talking about. And in fact, what evidence there is for me shows that NHS England and the government do not use evidence. They use a smokescreen to pretend that they've got justification for their decisions. So for me, I've completely and utterly, as have you, lost trust in government policy and NHS England's policy, and then that trickles down to CCGs actually saying things that they're going to do for you, which you know is not based on evidence, and it's just not true, and it's not going to happen. And it's almost just a lie. In Lewisham, it served a population which has now gone up to 300,000. It used to be less than that, 260,000. And your area here is the greater Huddersfield area is probably, I don't know, 250,000 or something like that. Not so very different, but it's a big population to have no A&E and no service. And it's not acceptable. And if we were in Germany, not that I want to be in Germany's health service, but if we were in Germany, it was run by social insurance, it's a different model, it's not the NHS, it's much more expensive, but they have 50% more doctors, 50%. And they have nearly 3 times as many beds. Now, I don't want 3 times more beds in England, but double the beds we've got would go a long way to solving the winter crisis, especially if some of those some of that money was in social care and rehabilitation rather than in just cuts. Lewisham was thrown into alarm in 2012 when they announced the closure of potential closure, and it was a full-scale, it still is by the way, a full-scale major A&E and the whole panoply of district general hospital services. If they'd closed it, it would have been one A&E for 750,000 people at Queen Elizabeth Woolwich. One of the things about that was that it's a PFI hospital, which was therefore why it wasn't even in the frame to be closed. Not that I wanted it to be closed. And it was built for one borough for 250,000, and it was in permanent meltdown because they'd already closed Queen Mary's Sidcup 2 years earlier. So when they closed that, Queen Elizabeth was in permanent winter crisis in the middle of summer with 30 ambulances in the car park outside. Just before I go into a bit more detail, when we won that campaign, and then when we're into the world of sustainability and transformation plans and meeting the strategic partnership boards of the STPs, etc., we extracted a yes or no commitment from them, and they publicly stated that they were no longer considering closing Lewisham A&E because they could not afford to. And in their assessment of need, they in fact predicted the need for 700 extra hospital beds, which they were then going to magically cater for by care in the community. So if they closed Lewisham, I just don't know what would have happened. So we've been campaigning for 6 years now, and we won. We won a year later, essentially, when the appeal in the High Court was victorious. And we've carried on fighting because as a strong campaign, we felt we were always going to be in danger in Lewisham, and we had all the rest of the services to defend as well. Ealing Hospital was under threat from earlier on in 2012. They are still running, but they have, it's very similar because very, very good people, stalwart campaigners. 6 solid years they've been campaigning to save their A&E, and they're still under threat from it. 3 years ago, the CCGs closed the maternity services. 2 years ago, they closed the paediatric services, and they replaced it with an urgent care centre run by a private company. That, by definition, that is no longer an A&E, because an A&E takes all the emergencies of the community without defining them and sending them off. They do the triage in an A&E. They save people's lives, they assess them, and then they send them to the right place within the hospital, or if necessary, somewhere else. So Ealing is no longer an A&E because it can't deal with children and it can't deal with maternity emergencies. Nevertheless, it's the best performing A&E in the country was Hillingdon, which is John MacDonald's constituency. Since they closed North Middlesex and Hammersmith, and then they didn't succeed in closing Ealing and Charing Cross, this is all the same area, Hillingdon's become one of the worst performing in the country because they are just lying about changing capacity and demand, and they've got their sums right. They've got no sums at all. Somebody who was just saying, you don't think they know what they're doing. I mean, the problem is, I think they do know what they're doing. They are just absolutely irresponsibly deciding to close hospitals until they've saved a stack of money because they've sold off stuff and they're not paying for the hospitals. And it creates such pressure in the public system that people either just queue up or they go privately. And that's one of the forms of privatisation that isn't even the loss of a contract, it's just supply and demand. Going back to Lewisham a bit more, when Jeremy Hunt stood up in Parliament and said they're going to close Lewisham Hospital, so, he actually put in his statement that they are going to save Lewisham A&E, and it would be a small A&E. He'd listened to all the consultations, and they're going to make lots of changes in the area, but they're going to save a small A&E. And then he wrapped it up like Jackie's just said. It would be the elderly that were unwell, but emergencies would have to go elsewhere. Now, immediately, people were claiming that as a victory. Sometimes in the public media, 38 Degrees put out a press statement saying that they'd helped win Lewisham A&E. And we knew it was a lie right from the start. We had lots of good people, campaigners and also clinicians, who knew what an A&E means. You know, it means an intensive care unit, it means anaesthesia, it means ENT specialties that can protect airways, it means paediatrics, it means maternity. There's 7 characteristics at least that define an A&E that can deal with major trauma and so on. So it was a lie, and it was a campaigning lie from Parliament, if you like. We knew straight away that we weren't going to accept that. We've been able to stave off the death by 1,000 cuts so far, but we know that that is what's going on up and down the country. What they've done in Ealing, they're now doing in South Tyneside. They've moved maternity already, they've moved inpatient paediatrics, and they're about to try to close that down. They've moved stroke already. Some of them they've moved on safety grounds because they can't staff it. And as campaigners, that's very hard to deal with, because you're saying, well, we don't want to be responsible for unsafe services, but it's the responsibility of CCGs and of councils to demand of government that they fund services properly, so that there are enough nurses and there are enough doctors, and there's social care out there that can cope with people that are able to go home. In Lewisham, and I think locally, you had the partnership with significant people in the council that were willing to stand up and fight. In Lewisham, it was actually, we were told by councillors that the strength of the campaign made the council realise that they too ought to be part of the campaign. And hitherto that, they may have just sort of rolled over and accepted it. But they joined a judicial review, as did we. When we decided we would put in for a judicial review, we didn't know whether we would get one. As you've been through that process, you're applying for it first, and it's harder and harder to get leave. So we also set up a People's Commission, where we were saying, even if we don't have a judicial review, we will have our own day in our own court, and we will interview patients, and we will interview doctors and nurses and paramedics. We actually did that, and that's very powerful testimony, which included a very good definition of what an A&E really is by an A&E consultant. I know you've been through all of those things, and I should have started with this. You're a magnificent campaign, and you're an inspiration to everybody. It's strange, in London, Ealing always praised Lewisham for what we've done, but in fact, Ealing had been struggling longer, and they didn't have certain little bits of luck that came our way, and they had a judicial review that was rejected. They rejected the right of judicial review. They did go down the independent review panel route, and that panel agreed with the CCGs in principle, but said you cannot make the changes that you want until you have proven that your alternative setup works, and they've been unable to do that. They didn't even have a business case for it. So I think that the analysis that you've done and the pushing them all the way is really, really important. It's interesting that the £197 million figure comes up, because it's just extremely close to the £195 million that they were going to invest by demolishing 60% of the Lewisham site and then rebuilding capacity such as maternity in the King's site. And they were going to take 20 years to break even on that supposed saving of money. But I have to say that the total lack of trust now has a track record that is second to none. when they say they want to integrate services, they actually are disintegrating services. They're destroying social care, they're tendering for bits of the service to different companies, they're breaking up the country into 44 different parts that won't even be part of a fully joined up National Health Service anymore. And when they say community-based care, and community-based care was very important for me as a community paediatrician, so that children with a disability could live their life in their community, in their home, in their nursery, in their school, at play, supported by a team around the family that would actually allow that child to take part in life. That's what community-based care is. But for me, care nearer your home at the moment is virtually care nearer the cemetery. Because you're cutting palliative care nurses, you're cutting health visitors, you're cutting school nurses, social work's been destroyed, substance abuse teams are being cut, public health measures such as cessation for smoking is going. So all the bits of community services that would sustain any ill person in the community or do the preventative work is slowly but surely, quite rapidly in fact, being eroded, and they're just lying. I think we need to, first of all, hang on to this hospital until death, because you need this hospital. You must not give up. You must go the extra mile that you've already been down to make sure you're on top of all the data, analyse it and challenge it, and it's great that you've got such a fantastic campaign. We need to be demanding more doctors and more nurses and more beds in our hospitals, not closing them down. There's evidence that shows that for every reconfiguration, it never saves money. It just does not save money because people still exist, people are still ill, and they have to go somewhere else, and they usually go somewhere else iller or sicker. And of course, there's all the social costs as well of transport. You've been through such a hard several years of non-stop campaigning, and you have really been magnificent. And yourselves and Mike have seen the importance of linking up nationally as well. And I think for me that's another going the extra mile, but it's really important because you learn from other people and other people learn from you. And that's been hugely important. And that's why health campaigns together, of which I'm part and you're part, and Keep Our NHS Public, of which I'm chair, that's why we exist, because we can spread solidarity, and that's the way we will win. Now the thing is, you may feel that you're up against it now, and you're either going to be destroyed by 1,000 cuts bit by bit, or you're going to have a whole new campaign opening up for a new business case, and you're going to have to start again. But you just need to know what you have achieved. You've beaten them on this one because you've exposed what they've done. It's hard for you because it's not an outright HRI exists with a full A&E and everything. But you have to fight every inch of the way now. So Mike told me that paediatrics has already gone from HRI. I don't know about maternity. It's going. And community care, coronary care and ITUs, that's still on. Because I think you've really got to analyse and keep on top of all those arguments and fight every step of the way for that, and you know that. But Lewisham won. I regard this as a victory. Ealing's won in the sense that it still exists 6 years after, and they've still got a very busy hospital with acute wards, medicine and surgical, but they are still under threat. Campaigning has turned the Chorley Hospital from being closed for an A&E back to 12 hours. That's a huge partial victory. There used to be people in our campaign saying, well, you haven't really won because it's not a total victory. But these things are very, very important for our morale, and they really mean something for real people. The sustainability and transformation plans, which are a real panoply of delusions, we toxified those by campaigns, and they have really fallen apart. They've been even the King's Fund and other people can criticise them very strongly. We toxified then accountable care organisations, and the government started to have to make concessions around the judicial review and then change the name to integrated care providers, which is the same as an ACO. But we've forced those changes on the government. Although the NHS is still underfunded, that concession from Theresa May in June, 20 billion extra, that wasn't 20 billion to repair the damage, but it was slightly less damaging for the next 5 years than it has been for the previous 8. And that wouldn't have happened without campaigners. And I really think we need to list sometimes all the victories that we've achieved. The subsidiary companies that you're probably aware of, there's threats all over. I don't know about Huddersfield, but they've overturned them in Wrightington and Wigan, in Bristol. They've overturned them in mid-Yorkshire, all over the place, and they're now possibly putting that on the back burner as something that has also been toxified, because it's privatising tens of thousands, hundreds of thousands of staff, and campaigning has had a huge impact. I think that sometimes you can win outright, and sometimes you just have to say we're slowing everything down, and one day there'll be a change of political direction. And if we'd lost Lewisham, it would be closed by now. So 5 years later, 6 years later, we're a little bit tired and we've lost weight and lost a lot of sleep. Put the weight back on now, but that would have gone, and South East London would now be in ruinous situation for the healthcare. So up and down the country, we've all been magnificent. And in the meantime, a lot of private contracts are real rubbish and they've failed. You know, we've taken children's services back in Surrey from Virgin, although they then tried to sue. They've just taken children's services back from Virgin, I think in York. Today it was announced. All sorts of victories here and there, and then huge calamities like Carillion show how mendacious, how awful PFIs are, and how these big companies are starving the NHS of funds for their own benefit. But even then, they've gone bankrupt on occasions. So I think we have to feel confident that we're doing a really good thing. We have to take courage from each other. When I'm tired, I'll look at somebody else who isn't tired, and when they're tired, we can go and help them out. And we were at the Women's Hospital campaign in Liverpool on Saturday, a great campaign. I hope they too win, but they are very, very buoyed up by the solidarity around the country for them. So I hope I've given you something of the flavour of optimism that you have by your very spirit, but you need to carry on with. And of course, happy to answer any questions. Thank you.
When Vicky came up from Lewisham 2 years ago, she said to us, "You've got to meet Tony O'Sullivan." And when we went down on the 10th of October to Parliament, me, Jackie and Tony met in Whitehall and said, "I think we should have a national demonstration on the 4th of March." And that's where the idea came from. And that's why national solidarity is so important. And in recognition of that, Health Campaigns Together have elected me as their co-chair, because they recognise the strength of this local campaign. So, in terms of our milestones, we have a number of events coming up. The steering committee has considered the proposals of the Trust. They haven't pulled the wool over our eyes. The Let's Save HRI campaign thought that it was a victory. Their chair today has said, perhaps it isn't after all. And him and I have had a conversation today, and I've said, welcome to the team, Mike. We'll be working together over the next period. So we have got plans that we'll outline at the end of the meeting, but it's over to you now, guys, in terms of other questions or contributions about what you all think about the proposals you've heard, and also any questions and what you think we should be doing as a campaign. Yes.
Obviously the strength of the campaign around the Huddersfield Royal Infirmary is that it's a community campaign, because the message is these are health services which we need, don't take them away. But it strikes me there's another side of the coin, is that when they are planning this kind of destruction, they're also planning massive disruption to the dedicated working lives, not only of the healthcare professionals and nursing and all the clinician people, but also all of the ancillary services, you know, the porterage, the cleansing service and all the rest of that. And so it's that thought that leads me just to my question. I've been involved at a periphery of this campaign because I live and work in Bradford. But the question really follows on from what I just said, and it is, to what extent have not only the professional associations like the BMA and the Royal Colleges, etc., but also the trade unions involved in organising the healthcare workforce, have they been brought on board with the hands-off HRI? And if they haven't been brought on board as fully as might be, what can be done about that? Because I think what we want to see on the next demo is trade union banners representing every section of the workforce whose working lives are being disrupted and are torn apart. Thank you.
Richard at the back, a supportive councillor, I think.
Thank you. Yeah. Well, first of all, I just wanted to apologise for missing the first part of the meeting. I had to go to the Trades Council about another issue. But I just wanted to say a few things and really ask a question. The first thing I wanted to say was that I don't know whether people would agree with this, but it seems to me that the powers that be have actually got a tactic, and their tactic is to try and make everything as complicated as they possibly can, so that, you know, ordinary people, campaigners won't really see the truth of what's going on. And I think we have to kind of reply to that as a community with two simple messages. Firstly, that these proposals aren't acceptable, they cannot be acceptable, and they can't. And secondly, the struggle has to continue. So that kind of brings me to the second question. So I think I saw Nell at the front. So there's at least two councillors here tonight. I rushed in. But the question I wanted to ask the speakers, and you may have covered this, and apologies if you have, as local councillors, as a council, obviously the council has taken a position on closing HRI, and local councillors have been campaigning. But I think it's true to say we're moving into a new stage now as a campaign. So I would just ask you really, how would you, the campaign like us as local councillors, to fight these proposals? What would you like us to do?
As hard as possible, as loud as possible, as strong as possible, and as often as possible.
Well, what I would like...
Can I just finish? Also, I would like to say this. I would like to see the Health Scrutiny Committee actually sit down with the people in this campaign who really know their stuff, so that when they go to scrutinise the CCGs et al., that they ask really searching questions, and when they get the rubbish bollocks answers, I'm sorry, but they do, that they know enough to follow up and say, what do you exactly mean by that? When is that going to happen? How is that going to happen when you haven't done this? We need them to be really good at scrutinising these people, because they are so clever at what it says in the newspaper, magic words. It's not the language I would use, but that's their magic words. Management speak, etc. And we really need the council to really put them under the thumb when they meet as a scrutiny. And I am so sick of hearing, well, scrutiny isn't political. Sorry, it is.
Sorry, just to finish the question, because...
Sorry. I thought you'd finish it.
No, I don't think that's what you put out of because, you know, you were saying, Tony, I used to live in Ealing, and I actually went to visit some mates who were involved in that campaign. And the local councils actually seem to be organising the petitions against it in Ealing. So I went to a meeting, you know, as you do when you're visiting London. Anyway, but basically, I just wondered if you could tell us a bit more about how local councils in London are opposing the closures and stuff as well, and nationally. So that's
Audley, is this about banners?
No, it's about the councillors. What I would like to see, Mr. Councillor, is for all of you councillors to get out on the street with us and show the people in Huddersfield that you are on our side. You are doing a great job, don't get me wrong, but the people don't know that you're doing it. We want you to come out publicly and support us. You know, I don't mean, I know you come to our meetings, and thank you very much, you're doing brilliant, but the other councillors, they're not coming out, and most of them are Labour councillors. They're not joining us on the street fighting for our hospital.
Are you all done? Matt?
I'd like to thank Tony Sullivan for his brilliant speech. And I think it's great that we've got people like yourself, people like Jenny Hurley, who's come from Charlie. Thank you, Jenny. Because we really do need to link up, because clearly it's absolutely part of a national scheme by the government to ration and privatise healthcare, which is an absolute disgrace. I mean, I don't know if people are aware at the moment there's a consultation which ends, I think, in about 2 days about rationing the practices that can be dealt with locally. Things like glue for kids. I think there's about 14 different health conditions where they can say, oh, we don't have, you know, they can say, we don't have money for this, we're going to ration it. What that means is, most kids, most people who need these procedures won't get them, but it means that people with money can afford to go to private clinics and get them. And that is the way they want it to be. They want us to go into the American system where you've got private healthcare insurance, and if you don't have it, you don't get the services. So I think it's so important that we do link up, and I think people need to go online on that consultation tonight if you can, not tomorrow, and just check that out. If you check out the 999 NHS campaign, there'll be information about it on there. Clearly, I mean, you talked about community health. We've had privatisation in community care, haven't we? It's gone to private companies. You talked about Carillion, where they don't give a damn, do they? All these companies are bothered about is making a profit. When the profit's not there to be made, they don't care. We've seen it in care homes, where they've just closed the care homes, moved people out, and people have died as a result. And we really do have to up the ante now. And with Bridget, 100% of the way. And you know, people do need to be made aware of what's going on. How many government ministers, how many Tory MPs have got shares in companies that invest in health companies? Often you can't even see it because they've got shares in private holding companies, and then when you track it down, these people are actually pushing the agenda and they're making money out of it. You know, the top 1,000 people in this country have trebled their wealth since the collapse of the banks in 2009. Make it think, if the banks collapse, they lose the money. They haven't. They've trebled it. We know why. Privatisation
Ian?
I'd like to answer the councillor when he said, what more can we do? Basically, the council as a whole, I'm not playing politics here, claim they're broke. And yet we've got a statement here that both Kirklees and the Calderdale Council say the changes won't increase the burden on their services. It's how to increase the burden on your services. And to be quite honest, I think this council as a whole hasn't backed this campaign. I've argued with the other different councillors, and all I get off of is it's political and we aren't allowed to do political. And my argument has been is once you start anything, it's political. Even if you sign a petition of anything, and basically everything this CCG is doing is putting extra burden on this council, and you should be fighting it tooth and nail to protect the people of Kirklees and Huddersfield, and not just sat there, there's nothing we can do. It's not our prerogative. You should be in the examiner virtually every day, the council said this, the council said that.
Can I just say Richard's been brave enough to ask us what. And as he said, there are two newly elected councillors in the room tonight who were only elected in May this year, and they have been very strong supporters of this campaign. So
I'm not saying they don't support someone.
No, I know you don't. I know you.
And I said the council as a whole.
Yes, you're right. So I hope you're not taking offence, Richard. Yeah, it's 20 to 9, folks. I'm going to take a couple more speakers, and then we do need to outline what our next steps are, because we're appealing to you who've turned up tonight for extra support and help. Yes, Steve.
Yeah, just the point I wanted to make in response to Richard's request. Obviously, we asked the council to cooperate and come in on the judicial review for the main business case, and they refused. Now, since then there's been a change of leader and some changes of councillors. I think if the business case is withdrawn and then there has to be a new one, that would be the time, and we've not agreed this campaign. So, but personally speaking, when I'd like the council to come in either as a co-respondent or possibly a joint party, but certainly to get involved in as a party in some way with the judicial review, and that certainly takes some persuasion of fellow councillors, I suppose. But yeah, I think that'd be a good move.
Yeah. Thanks, Steve. Last speaker.
I think people in Kirklees and Calderdale don't realise that we have one of the lowest provisions of beds, hospital beds, in the country. Our provision of hospital beds is worse than a lot of third world countries. And I think what we need everyone to say, including the councillors, is okay, the status quo isn't an option, cuts aren't an option, we need more money, and we can bloody well afford it.
Yes.
And the bloody banks are being bailed out, and they're corrupt, and they're destroying this country, and we need a completely different political discourse coming from our representatives. Not we're going to cut you, but we're going to fight for more money, and we're going to join your demonstration. I want to see every councillor on our demonstration.
Yes, well said.
Yeah. Do you want to come back to me?
Could I just say something?
Oh, Del.
Sorry.
Yes.
Unaccustomed as I am. Just to say that I'm on the Helping Adult Social Care Scrutiny, and one of the things that's happening at the moment is there is a move to start relying more on volunteers in the community for social care, and create hubs in things like libraries where people who are, often elderly people who are perceived in need of more support can be put in touch with other people who need more support, and they can, and thus savings will be made in that budget. Now, at the moment, they are getting together a panel of users, so if any of you know anybody or are yourselves in receipt of social care, I think you've got 4 more days to sign up to be a consultee on that panel, and it'll just be another avenue for saying no, that won't work because, and you know, I know it's small, but it's something that could be done. And if anybody wants me to send them a link, just give me your email and I'll do that when I get home.
Nell, could you put that link on our Facebook page?
Oh.
Could someone help Nell to put that?
If I email it to somebody, can somebody put it on the Facebook page?
Yes.
Yeah, okay.
Thank you. Okay, I'm going to ask the speakers to come back and then I'm just going to go through our next steps. So Jackie's just going to say a few words then, Tony.
Yeah, just really quickly. I mean, today I'm sure probably a lot of people will have seen the figures that have come out about life expectancy in this country of flatlining. And one of the major reasons cited for that is austerity. Because the cuts that have been made in the NHS have increased at such a pace over the past few years that all the time we're seeing now, certainly I'm seeing the direct consequences of that on a daily basis. I mean, the parts of the health service in the community that the council have taken over, that Locala are running, health visiting, sexual health. I mean, God, I can't even begin to say how appalling these services are and how much additional strain they put on general practice and other services because they're so woefully inadequate. The threshold for, I mean, social services as well, the threshold now for safeguarding, for social services getting involved in any safeguarding issue is so high, children have to be at direct risk of physical harm for them to get involved in anything. And then we can't get a health visitor to go and visit them either because there aren't any. I could just go on, to be honest, about how frustrating it is to work in the health service at the moment. And as GPs, we are picking up the pieces for all of this other stuff that is falling apart around our ears. And I am just dreading the day that A&E closes, if it does, because I know that we will begin immediately to see the consequences of that. The devastation of dental health services means people don't have dentists. So what do? They wait till they've got an abscess and then they come and see the GP or they go to A&E. And then they wonder why there's increased burden on these services and we don't have the capacity to deal with it. You know, the list goes on. And we are seeing the direct consequences of that. So we have to fight tooth and nail to stop these cuts from happening in our local area. But also, I would agree, we have to fight on the wider issues. We have to campaign with other people that are campaigning on the same thing. But I understand that we don't have time to do everything. If we win this campaign, though, if we win even a slight victory, but if we win, then that sets down a marker, it sets down a precedent, it gives an example to other people about how to conduct their campaigns and we can help them out. So it is extremely important that we continue to fight in this area. If we do nothing else, that we continue this campaign because we have to win. I just, I can't imagine what life will be like if we don't, basically.
I think, first of all, you should tell yourselves that you have won a huge battle. You haven't won the ultimate victory, but you have won a huge battle, and you've delayed things hugely. So the HRI lives to fight another day. There's a question about councils in London. I mean, Ealing and Hammersmith, 2 different councils, have been fantastic in opposing the closure of those hospitals, in coming out fighting, in supporting an independent commission of inquiry, which Michael Mansfield chaired and John Lister did a lot of work for. And they've opposed the STPs as well. And when they were sort of blackmailed as well, if you don't sign these STPs, you won't get something like £90 million for care of the elderly or some other fund. They said we won't be blackmailed, we're opposed to it, and they've held true to that. Other councils have been less out there than Ealing and Hammersmith, but they have done a lot of good things. And in my local area in South East London, we've done a lot as a campaign. We've realised that councillors maybe have one brief, maybe have 2 briefs, but they struggle to be really good at everything. And we've taken on assumed a task now that if there's an issue coming up, whether it's the Naylor report or whether it's the integrated care systems or whatever, we have to brief them as succinctly as we possibly can. We're aiming it at the whole of the scrutiny panel councillors as well, and that's had a really good impact, but it's patchy in London. There's a feeling in the room that, well, for me, in the past, Labour have sat back as councillors and said our job is to say that we're in charge, we're responsible councillors, and these cuts we can cope with and not to cause panic. That's completely the wrong thing to do. They should come out fighting, and they should say if we've slashed health visiting or mental health budgets because the government hasn't given us enough money, we will give interviews to the press saying we have now got a dangerous service, not a great service that we've reorganised, a dangerous service, and the culprits are the government. And if we were doing that up and down the country every day, week in, week out, the press and the radio, we would be changing the mood of the country. So the councillors have to come out fighting. That's my view. A quick thing on the rationing thing. It is 17 conditions. There's a really good briefing that we've put on Keep Our NHS Public website as well. So you've got 2 options, 999 and Keep Our NHS Public, with a sort of model of answers that don't repeat it word for word if possible, but it's there because it's quite confusing. In Bristol already there are 104 conditions being rationed, 104, and the consultation on the 17 from NHS England explicitly says that this is the tip, this is the beginning. They all think that this is great news, and there's going to be dozens, if not hundreds, of conditions that are rationed, so it really is important. The third thing, I think, is that I think we should aim at saying positively what we want from the health service. That might sound stupid, but we want, in a community that's serving over 200,000 people, we want a safe A&E for children. We want a safe A&E for women who have an obstetric or a gynecological emergency. We want an A&E for people that are bleeding or have meningitis. We want 95% of emergencies are not needing a super specialist stroke unit or major trauma unit or something where you're shipped into Leeds and your life is saved and you're thankful for it. You need urgent care here and now, and time is critical. Now, I think we need to say what we want, and Jackie and councillors and everybody, that would be an achievable thing, that we want an A&E that has mental health people in A&E to look at children that are self-harming, adults that are self-harming. What is the minimum requirement for GPs that needs their support, that they don't want privatised, fragmented voluntary care organisations. Not that there's anything wrong with voluntary care, but it's replacing core services. So I think that would be good, and it compares them with what they're trying to give us. So that's a big ask, but I think we should do that almost nationally as well. We should be setting the standard that we want, because actually we're so much on the defensive. We need to come out fighting. The last thing is that on the Carillion issue, it's just the last victory. That Carillion had 2 huge PFIs that they were pocketing hundreds of millions of pounds from, but they've collapsed. Those 2 PFIs were sitting there with the hospitals. Nothing happened for 6 months. The government has now been forced to take both of those hospitals back into public ownership, and those PFIs are gone. So I think that's another victory for companies.
Which was in Liverpool, so that's great. Right, folks, and to add to the list of campaigns that have been successful even over the last few months here in the north, then we know that the Glenfield Children's Heart Hospital was saved after a long campaign, and one of their speakers came up to address one of our honks. We know that the Chatsworth ward was saved, and again one of their speakers came up to talk to us. And as has just been said, you know, the Liverpool PFI has now been bought out, which is a very interesting development, and one that we'll be following closely. 3 months ago I spoke at the Sheffield demonstration to save their walk-in centre. Last Thursday it was announced that the walk-in centre will now not be closed. So we can win. And all of these campaign groups have wanted to meet us because they look upon this campaign as one that has encompassed all of the different aspects of campaigning and mobilising the local community. So that's why, and Richard asked the question, what can we ask councillors to do? And I think there are some of the responses there that will undoubtedly be taken back. Perhaps I thought that's what Audley was going to talk about. We wouldn't want the council to keep taking down our banners when we put them up. But we did meet with the leader of the council and invited Kirklees to join our judicial review. We couldn't even get the legal officer from the council to come to one meeting that we had with Erwin Mitchell as an observer. So we have been kept at arm's length. And the reasons they said was because it would jeopardise their legal processes, because they were involved in Health and Scrutiny Committee that was looking at a proposal. That's now finished as far as I'm concerned, and Kirklees have jumped into the debate with their own proposal, which has the support of all the political parties. And if they're serious about that proposal, they're going to have to fight for it. And they will have to fight with us. If there's 300 million quid extra invested in the NHS in this area, we are going to say that's a bad idea. Where a new hospital might be and how that money is spent, we want to have that debate because we have a view that maybe if that 300 million quid was invested in HRI, we wouldn't need a new hospital. But that's a debate that we want to have. And at last, Kirklees has come off the fence and decided to pitch into this debate 2.5 years later than perhaps they should have done. Just in terms of what we're doing next. Tomorrow, any of you are interested at 10 o'clock, we will be meeting with Tony again for longer discussions about the intricacies of next stages of campaigns and what we're doing. I haven't announced it yet, but I think we're going to meet at the Harold Wilson statue at 10 o'clock. At the moment, the only people that have come from the request on the Facebook page are men. So please come along, please come along, those of you who are interested in talking to Tony. He's delayed his trip back to London so that we can have further discussions. On Thursday, as we've said, Steve will be meeting with the Trust, with the surveyor that we employed to look into the longevity of HRI. We're going to see if there can be a meeting of minds. They say HRI's got 10 years life. We say, or our surveyor says, it's got 60 years. So that should be an interesting meeting, and we look forward to the outcome. But most important of all is our demonstration on Saturday the 6th of October. Now this is the 4th time that we've called the people of Huddersfield out onto the streets. We appreciate when we go out there, a lot of folk think that we've won, we've saved the A&E, HRI is staying, why are you still there? And that's why we're having the demonstration. Those of you who recall the Trades Council demo last year, when we had to employ a traffic management company, we paid them 1,200 quid to stop the traffic. They're doing it for nothing this time. And the reason they're doing it for nothing is I've said we will stop the traffic. And that's how and it seems the council have agreed to that, which is progress. So there are some postcards left on the desk here. Can you please take those away and spread the word? We don't want 2 men and a dog on a demonstration. We want to have a sizable protest on the 6th of October.
Is there going to be a reprint, Mike?
Well, I don't think we'll be doing any more cards, but we'll do some more leaflets if people want more leaflets. But we've got rid of 5,000 postcards so far, and we've less than 2 weeks to the demonstration. But we will produce more leaflets if they're required, but it's getting the word out there.
Will you be putting it in the Examiner?
Well, we've already sent the press release to the Examiner, and you've seen the press release for our public meeting is this, but anyway. So we'll be doing more press releases, but yes. And that brings me on to the specialist committees that we have in the campaign. If you're not part of a local group, please join a local group, because we are looking for new blood. We've got 3 committees that meet on a regular basis to look into media, how we get our message out across there. We've got events and fundraising, and we've said tonight that fundraising and the events that we organise are going to be critical to taking forward the next stage of the campaign. So if you want to join the Events and Fundraising Committee, the Media Committee, and we also have a Legal and Finance Committee that are liaising with Erwin Mitchell and of course looking at the finances of our campaign, which are in quite good health, although we've just had a bill for £11,000 from Erwin Mitchell. So that will take a certain, that's why I kept teasing him about the costing. You'll understand why now. So the sign-up sheets at the front, you've signed in, there is a box there. If you want to join a committee, will you please tick that and say which committee you'd like to join? Because those of us who have been doing this for 2 3/4 years, there are several faces that have had to drop out for personal reasons, but some of you who are new to the campaign, your talents will be much appreciated over the next course.
Please.
Please. So I think tonight's meeting we needed to get the legal update. I hope that you now appreciate where we are with that. Erwin Mitchell are still very much on board with us. We understand what the Trust are trying to do. They've tried to pull the wool over our eyes. They haven't. We've got to get the message out there. And we wanted to hear from successful campaigns and the national perspective, which we've heard. So we've given you a general picture. This is one of the very few meetings that as we've gone on, it's got bigger rather than smaller, because as people have drifted in from the Trades Council meeting, we thank you for coming, then the audience has expanded. And thanks to John for Facebook living it, because there are more people that are in the audience tonight who are watching the meeting. The last point I want to make is, of course, we always have collections at our meetings, and I think we've all been negligent. I don't think anyone's bought a bucket, have they? No? Which is, Ian, isn't that unusual that we haven't got a bucket? But anyway, there's a bucket there. So, can you please, yes? Yes, I'm on, folks. We haven't quite finished. Yeah.
Can I just say that we desperately need more tumble prizes? If anybody's out there willing to donate anything at all, let us know. Put a list up of what sort of things, but mainly sweets, bottles, anything like that we can wrap up and use at our fundraising events. We desperately need them. Thank you. We sold up on Saturday.
And since they made their announcement about the new reconfiguration, we've totted up that we've raised another £3,500 from the community of Huddersfield. So, of course, we are doing a fantastic job with the fundraising initiatives that people have been giving up so much time. But, of course, we need extra support. So, there we go. So, thank you all very much for turning out. See you all on the 6th of October. Don't come on your own. Bring your family, bring your friends. And I take the point you make about trade union banners, and that we have invited all the trade unions to join us. And don't leave without giving us some money. So I'll close the meeting, and thank you all for coming.